brain as it relates to cognition. Most of us, one of the concerns as we age is the whole idea, is my brain okay? Is my cognitive function going to decline to an extent that I'm going to be dependent on others? And so it's an important factor to maintain and optimize throughout our lives. The brain is greatly affected by every part of our body, and so we start by saying, let's make sure that the whole person is healthy and balanced. Balanced hormones lead to a better brain. Optimal nutrition leads to a better brain. Decreased oxidative stress and free radicals that cause damage to the brain are important to address. But once we do all that, are there any other things that we can do to enhance brain function? Well, we can test cognition, and there are some wonderful batteries that we can actually do online and that are not expensive, that can actually give us a benchmark so we can look at what our memory is doing. And that now we have something that we can come back to and compare and say, hey, is my memory improving over time? But there are several products such as low-dose lithium. Lithium gets used for people with bipolar disorder at dosages of 100, 200 milligrams 4 times a day. When we use tiny amounts like 5 milligrams, it's used as a nutritional product, and it actually encourages increased formation of dendrites or connections between the brain. So it's a cheap, simple strategy that can improve brain function. There's a product called Avopaxin that we use that not only does it lower inflammation, but it has an herb that's standardized called huperzine. Huperzine increases acetylcholine in the brain. Acetylcholine is the neurotransmitter of cognition. All of our Alzheimer's drugs right now they're acetylcholinesterase inhibitors. They try to slow down the breakdown of acetylcholine. But for those of us who don't have Alzheimer's, taking an herb like huperzine and encouraging our body to make more acetylcholine can improve our cognitive function. There are brain nutrients like phosphatidylserine that not only do they help us respond to the cortisol levels at night, but actually feed our brain and help our brain sort of insulate itself with the right fats around the neurons. Optimal levels of essential fatty acids like EPA, DHA are crucial for brain function, etc. So overall, when we look at cognition, we think first of optimal health and address nutrition, address hormones, and all the things that we would call the basics. Optimal adrenals, optimal thyroid function, and then consider additional herbal or natural supplements that can aid and improve cognitive function.